Hi there, Dr. T here from Alleviate Dry Eye. Today we're going to talk about a very common eye infection that occurred during self-quarantine. Now, a lot of us have been staying at home during COVID-19 and self-quarantining and trying to social distance, and we've learned a lot of things about ourselves. That's been a topic of many a Facebook post. And today I want to talk to you about an eye infection that became much more common during this time. Hi there, I'm Dr. T, the author of Alleviate Dry Eye and the clinical director of the Dry Eye Center here in Shreveport, Louisiana. Thanks so much for joining me today. At Alleviate Dry Eye, you can learn to take care of your eyes like it's the only pair you'll ever have. So what was going on during quarantine? We were all at home. No one should have been coming into contact with any bacteria. So how was everyone coming up with these eye infections? Well, let's first talk about styes. There are two types of styes. The first is the external, otherwise known as a hordeolum, and the second is the internal, which is also called a chalazion. So the external will be formed on the front of the eyelid, right at the top, and there will be a little white head, whereas the internal usually is a gland on the inside of the lid that becomes clogged and infected and a little bit larger, does not have a white head. So there are two types, and they are just a little bit different, but basically they both come from bacteria that gets into an oil gland, which then forms a red raised bump that's a little bit painful, irritating, usually doesn't cause extreme pain, but it can be uncomfortable. So in the first couple of days of a stye, first you might notice that your eyelid is tender, and then it may become red and raised. After that, it usually forms a localized bump, so a round bump on the lid, upper or lower, it doesn't really matter. They can come in both places. And then the white head will form or it will not. So why were we getting all of these eye infections during self-quarantine? So as I said, this is usually come from a bacterial infection, and there is a bacteria called Staph aureus that is most commonly found in your body, in your upper respiratory tract and on your skin. So it's very common to have that bacteria on your eyelashes. Now, during self-quarantine, we were wearing our masks. So all day long, you're breathing air up into your eyes. So more of that staph bacteria was getting up into your eyes. Now, on top of that, maybe you're a contact lens wearer or a makeup wearer, and you're more likely touching your eyes. So that's another reason that if you touch your eyes a lot and there's bacteria on your hands, then you're getting that on your skin and around your eyes and your eyelids. So who is more commonly going to get a stye? Someone who's previously had a stye. Unfortunately, these tend to come back because perhaps you have an overgrowth of that staph bacteria on your lids and lashes. Maybe your skin type is just really delicious for those bacteria to live in, and so they thrive there and cause recurrent infections. Someone who wears eye makeup and is not taking it off properly would be another candidate for having recurring styes. Make sure that you're removing your eye makeup every night. That's one of my cardinal rules for all of you who have sensitive or dry eyes. And if you'd like to get my guide for eye makeup removers for sensitive eyes, you can do that at www.pamterrio.com/makeup remover. You can download that guide right there. Another couple of things that could cause you to have recurrent styes or be more susceptible to styes are having blepharitis, which is crusty lashes, rosacea, which is pink cheeks, when you eat spicy foods or exercise, or perhaps you have diabetes. Those are all associated with styes. And then if you tend to use your digital devices for several hours at a time, you are probably suffering from a reduction in your blink rate. So how often you blink your eyes during conversation is about 20 times a minute. and how often you blink your eyes while you're on a digital device is less than 10 times a minute. So sometimes 5 or 6 times only a minute while you're using your digital devices. If you'd like to find out more information about how to help your eyes while you're on your digital devices, you can check out one of my blogs, which was at www.pamterrio.com/blog/58. That's 58. I go over all sorts of tips on how to increase your blink rate while you're on the computer. All right, so what if you have a sty today? Well, don't touch it and don't pop it. And next week, I'm going to share with you the best ways to treat and prevent styes. So thanks again for watching with me today. I appreciate your time and I hope these tips are helpful. If you'd like more information, you can always check me out online at www.pamterrio.com or in the office at Les Guy Specialists here in Shreveport, Louisiana. Thanks again for watching. Bye-bye.